to, recording. All right. So recording will start soon. Jen, can you make sure that the recording is working? Looks like it is. All right, awesome. Here we go. Welcome to April State TA Day. We have a very packed agenda for this meeting. I posted it in the chat, posted again. Going forward, these are always going to be on the invitation. So if you ever want to check out the agenda beforehand, it should be on there. We're going to go ahead and start with some introductions. So I'm going to hand it over to Lilith for a moment to introduce herself, even though many of you probably know Lilith.
Thank you, Charlie. My name is Lilith Huff-Munoz. I was recently the Senior Data Manager with Denver's Early Childhood Council, and I'm joining the state as one of the QRIS coordinators. And I'm excited to be working in this different capacity with early childhood councils and all of you as well in kind of a different capacity.
Awesome. Thank you. Just a reminder, when you're sending Lilith an email, make sure you are sending it to her new email address and not her old one, as many of us have her email address autofilling. I know that was an issue when I started over at the state. I also would like everyone to meet Christy, who is going to be a new grant manager that we have on the team. Christy, take it away.
Hi, everyone. I'm Christy Ressler. I come to the state after 20 years of being a provider both in after-school care and also early childhood, mostly early childhood. Most recently, I was the founding preschool director at Parker Cornell Charter School, and I built that program from the ground up. I've also been a regional manager in after-school care programs. I am currently pursuing my master's in social work, so this is a jump for me from micro to macro, but I've enjoyed it so far. And got to meet the team on Tuesday, and that was fantastic as well. So just excited to be here. Thanks.
And Christy's going to be overseeing our stabilization grants with metrics. So we're really excited to have Christy aboard.
Awesome. Yes, our team was finally able to get together at the office on Tuesday, and it was absolutely wonderful to see everybody. All right, I'm going to hand it over to Jennifer McDonald, and she's going to talk to us about our pre-licensing curriculum.
Hi, everybody. Wait while my slides loading. For those of you who don't know me, my name is Jen McDonald. I'm the manager of the training and instructional design team within the Office of Early Childhood. I want to give you some quick updates on where we are with pre-licensing training, which is the curriculum for professionals seeking a family child care license, and then some other little training plugs for you guys. So we'll chat a little bit today about the curriculum itself, why we're doing this project, requirements for trainers going forward, the train-the-trainer process, and our timeframes that we are targeting, and go over some FAQs. I have a bunch of FAQs in here, but if at any point anybody has a question, feel free just to blurt it out, raise your hand, or enter a comment in the chat. So just let me know. So real quick, the materials that we are putting together for pre-licensing are a facilitator guide, a participant guidebook, and a slide deck. This new curriculum will be designed to be an interactive 15-hour instructor-led training. It can be delivered through any format that works for the trainer. So that includes virtual, that includes in-person, but it is designed to be led by an instructor and facilitated by an instructor. The materials will also meet accessibility requirements, 508 guidelines for the materials themselves. The trainer, and I'll go into the training materials in a little bit more detail in just a second. The trainer requirements. This is one we're getting a lot of questions about. So who can teach the course? With this new curriculum, we're also implementing a new process. So going forward, once this is published, Trainers will need to have a trainer credential, and I'll talk about that a little bit more. They'll also have to complete all the associated prerequisite courses that include basically everything that a family childcare provider needs to take to be licensed. So it's all of your basic required courses, such as infant safe sleep, standard precautions, and so forth. And they will also need to complete the pre-licensing train the trainer program, which I'll talk about in just a minute. And we are exploring additional ways to advertise pre-licensing training dates directly through the PDIS and using the training calendar within the PDIS. So there's more to come on that. So the Train the Trainer course will be a free self-paced online course. So like much of our other PDIS coursework, we're thinking it's going to be around 2 hours. It might actually even be a little bit shorter than that. It will be delivered and available through the PDIS. We will be translating the Train the Trainer as well. So it will be available in English and Spanish. And it will be available to anyone with a trainer credential. So the way right now that we are looking at setting it up is that only users who have a trainer credential will actually even be able to register for the course. And any prospective trainer can take the course from at any time and from anywhere. So this is how the training approval process will work. To get started, any trainer would need to apply or have an early childhood professional credential level 3, because that is the first requirement for the trainer credential. Once they have the trainer level 3 credential, then they would need to apply for the trainer credential, and then they would need to complete the prerequisite courses that are in the system, and then the pre-licensing Train the Trainer program. Upon completion of these items and the Train the Trainer program, then they would get access to the materials, and the training approval will be good for 3 years. So I see some, I do have a challenge speaking and reading and thinking, so just bear with me for just 1 second. If I see there's some questions coming.
Jen, do you want me to pop out some of the questions?
Yeah, that would be great.
So will the TOT be required for those who are part of the pilot with Sybil?
Yes. And that's just basically so that everybody has the same level of expectations and understanding on kind of what the curriculum is, how to facilitate it, and all that kind of stuff. It should be hopefully a painless process.
And then just from Christine, once a user earns the ECPC level 3, they can apply for the trainer credential.
That's right.
Cool.
Is that it?
Yes.
Awesome. Thanks, Charlie. Okay, timelines. This is what we are working for right now. So many people have worked with Sybil, who was an instructional designer with our office, to help develop the materials. And for those of you who are a part of that, I really want to thank you. We conducted also a pilot at the end of last year, and we got some feedback from our training professionals. And then now we're currently working on finalizing the materials. And I really am excited to see the way the curriculum is shaping up. I think it's going to be a really great tool. I hope it's a helpful tool. And so that's where we are right now. The red line is kind of where we are today. So we're working on finalizing the curriculum and the Train the Trainer. And then we're hoping to publish in English early summer this year. And then we'll be translating the materials and then publishing translated materials. We're guesstimating in the middle of Q4 of this year. We're exploring, it will definitely be translated into Spanish, and we're exploring hopefully other languages as well. We're looking at Arabic right now, but if you know of any other training needs, if you could let us know language, and if you have an estimate on the number of professionals you think might need to use those materials, that'll help us in some of our planning going forward. So what are the prerequisites for the Train the Trainer? As I mentioned, it's basically anything that a family childcare provider would need to take to be licensed. And there are 2 additional courses that we have in the system that we also want these folks to take, which includes injury prevention for homes and playground safety for homes. Those 2 courses will also be a prerequisite. This is the big question in the middle. Will pre-licensing be a self-paced online class? And the answer is no. Based on stakeholder feedback, and now I'm talking about the curriculum that family childcare providers take. I'm not talking about the Train the Trainer. So based on feedback, the length of the training, which is at least 15 hours, the learning objectives, and the feedback. What we know that participants need to be successful in this training. And we also know that family child care providers often have communicated to us that they can also often feel isolated in their work. We really wanted this to be an instructor-led and facilitated curriculum, and that's how it was designed. And so it will not be a self-paced online training that family child care providers can take. So who can teach pre-licensing? Again, it's anybody with a trainer credential who's completed the Train the Trainer self-paced course. Any questions on this? Because I know these were some of the big questions I've been getting.
We got a few on it being not self-paced.
Okay, good. I'm glad to hear that, Daisy, because depending on who you talk to, it's either a few or it's not been a unanimous response to that decision. So I understand it's kind of gone back and forth, but we're hopeful that the materials will be supportive for folks. And there are 7 modules, so they can be broken up in any way. They've been designed so that they can be facilitated virtually if needed. So
I do have a question.
yeah.
The curriculum that Sybil has created and that we're currently using,
Yep.
we're still good to use that until the new curriculum comes out, correct?
Correct. Absolutely. Yep.
And then anyone else who has previously been okay to teach a pre-licensing class, does that get revoked? How is that going to work when it's not with the new curriculum?
So I'm going to jump ahead. Great question. I'm
Okay.
going to jump ahead. It's the middle one here. So when do trainers need to begin using the new materials? So we're giving people hopefully 60 days between when it's published and when we're expecting folks to begin using the new materials.
Okay.
With flexibility, obviously, for different circumstances. We know the credential has a large backlog, the training credential. I mean, there's a lot of processes in play here, right?
Yes.
So if anybody does have a unique situation, please reach out to us. But at this time, if you any trainer can either use the pilot materials or their existing materials until 60 days after that curriculum publishing date. So we're anticipating that should be published around the beginning of July. So it will probably take you through August with the kind of your existing process. Does that answer your question?
Yep, that sure does. Thank you.
Okay, cool. When I am getting inquiries about renewing the vendor approval for pre-licensing trainers, I'm extending basically the expiration date until about that time.
Okay.
As well.
Great.
Yep. Couple other questions that I've kind of talked to a little bit. Will the materials be translated? Yes, they will definitely be translated into Spanish. That includes the facilitator materials and the train the trainer, as well as the participant materials. And like I said, we're exploring looking into Arabic for at least the participant materials as well. Right now, the training approval will be valid for at least 3 years. And again, does the training have to be taught by an instructor? And the answer to that is yes. So it will be, it's not designed to be like a correspondence course, right? Where the materials can kind of go back and forth with a participant and there'll be a final assessment. The materials really are designed to be facilitated by a trainer. Why was it created? Prior to this project, it was the responsibility of each individual trainer to create and maintain a training curriculum, which meant that they had to be up to date on all licensing rule and everything that was happening with the Office of Early Childhood. And as you can imagine, that was a burden for trainers and led to a lot of inconsistency. So we're hoping this will be a support as far as quality of curriculum, consistency of message, and a support for the trainer and the trainees as well. And then we talked a little bit about when trainers need to begin using the materials and where can prospective family child care professionals find a pre-licensing training. So from our perspective here at the state, we can support hosting trainings through the PDIS if trainers would like to do that. At this time, that will not be required. Maybe eventually that will be, but at this time, it's not required. However, if anybody would like to host their trainings or register their trainings through the PDIS, and then they would be advertised on the training calendar, when folks go in and do a search, we can definitely do that. So please reach out to us and we can support you in that. Any questions on that piece? I've included some links. These slides will go out after the session on how to get a trainer credential. You guys probably already aware of this. All information is available through the PDIS. The requirements for the trainer credential. So as I mentioned, in order to apply for the trainer credential, a professional has to have an early childhood professional credential level 3, and that's for the 2.0 credential or the 3.0 credential. They must have completed the trainer self-assessment and have at least two professional development goals established in the PDIS, and also completed the 2 training curriculums, training design and the adult learners course. The adult learners course, as you may know, is a bit longer, so it's one that takes a little bit more time. Just wanted to point that out. One thing I will note is that, just to kind of let you know, these 2 courses, as we know right now, are only available in English. We know this is a challenge, and I just wanted to let you know that it's on our radar, and we're looking at being able to translate these so they will be available in English and Spanish as well. Not immediately. We're working on plans for that. Let me be clear. So we're working on that. There's also a QR code in the slide deck we have a list of required training for family child care providers. And then just some basic talking points about what is the pre-licensing curriculum. Again, it's that 15-hour requirement that all professionals have to take before they can earn their license for family child care. And I think that's all I have. Anything else? I know Christine Bauer's on the call. She's been an amazing support for any of you who worked with Sybil. You know, she left our office at the end of last year. So Christine has really been willing to just jump in and help us with these materials. It's not a small lift. So I just want to throw a shout out to Christine for all of her work. And Christine, is there anything that you would like to add?
I don't think so. Just that, you know, we're open to feedback and questions that you have. We want to make sure that everybody feels confident as the materials are rolled out. And we're here as a resource whenever you should need us.
And Jen, there's a quick question. Have the resource links been updated in the trainer certification course? They only take you to the old PDIS 2.0.
Yes, I just answered in the chat. That's on our radar. We know that's a big one. And the answer is yes, that should be it.
Cool. And yes, we always send out all of the presentations with a follow-up email along with the recording of the state TA days. So as long as you're on the invite, you will get all of the presentations shared today. Cool. Thank you so much, Jen. We appreciate you and your team and the hard work you put into this. We're so excited to get this rolling. All right. So next, we have Tara Webster from CDPHE. And Tara and I had a chance to connect briefly at Rocky Mountain Early Childhood Conference, and she has some wonderful ideas of how to support some of the early childhood programs in our community, looking at environmental factors. So thank you so much for jumping on today, Tara. I'm so excited for your presentation.
Great. Thanks so much for having us. And I'll also introduce Francesca, who is actually going to take the lead on our presentation and share all about programs within CDPHE that have some overlap or connection with early childhood. And we have a couple that we want to focus on. But I just wanted to flag that we're constantly learning. We're coming from the Toxicology and Environmental Epidemiology Office, and taking this really kind of toxicity approach and look at environmental hazards, which may not always be the #1 thing on people's minds. So we want to find ways and opportunities for us to be able to support you all and early childhood education in whatever ways are supportive. So I think Francesca's pulling up the presentation, and I'll pass it over to her. Thanks for having us.
Hi, everybody. Hopefully you can see my slides. I was having a little issue with Google Meet earlier.
Yes, we got him. You can see
Awesome.
him.
So just to reiterate what Tara mentioned, so really the goal today is just to give you an overview of a bunch of different resources and programs that are available through the State Health Department, and also to get feedback and input from you. Choose Safe Places is kind of the major program we're going to talk about, and this is a new program, and so if you have ideas for how we can better support you in the early childhood education space, and thoughts about how to better connect with you or the right people, please let us know because we're always open to that. So again, really we're here because we know that children are especially sensitive to environmental hazards, partly just because of their size. They're getting greater exposure proportionally to different hazards in the environment, and also because kids are touching lots of things and touching their mouths and their face all the time. But fortunately, CDPHE has a lot of different programs and resources that kind of help support creating healthy educational spaces. And so again, we just want you to know what's here and get your feedback on what you might need that you don't see here. So Choose Safe Places, again, is our kind of big program. This is a voluntary, non-regulatory program through the state. And really the idea is for you to be able to consult with environmental health experts and get constructive ideas that you can choose to take back to your space, depending on your needs and your resources and whatever your particular concerns on. We want to reiterate, we can help you at any stage in the process with running a facility. So if this is before you open a facility, if you want our help in resources and things to think about in selecting a facility that will meet your needs and be safe, we can help you with an existing childcare if you're curious about changes or things that you could be incorporating into that space to make it healthier. Or again, if you're considering a move, we can help you with that process. The biggest things that we consider are the physical building or space. So we look at things like past uses. So if who ran a facility out of your space before, if there was an industry, if there was a different kind of shop or retail space there, we think through how those past uses might affect environmental health issues in your space. We think about the nearby industries. If you're in a strip mall type building that you have multiple buildings that share walls and ventilation, we think about outdoor exposures that might be relevant depending on where you are. And we basically can screen the location of your facility against a bunch of known environmental hazards that CDPHE has documented and provide recommendations based on, again, what's relevant to you, what we think could be helpful and incorporated into your space. So the best way to start this process is we have a Choose Safe Places questionnaire that you can find online in English and Spanish. And of course, we'll include that in the follow-up information, links for all of that. And you basically just answer, what the facility is, where it is, and anything that you might know that you think could be relevant to environmental health, and your main concerns if you have those. And then again, we'll go through this process and contact you and get that started. We also want to point your attention to an indoor air quality ventilation assessment improvement program right now. This is being run collaboratively with the State Health Department and Colorado State University. And through this process, you can get a baseline indoor air quality monitoring done. And they'll also appraise and inspect your building's ventilation system. And afterwards, they can do a virtual consultation to talk through the findings, any adjustments or upgrades they might recommend based on those findings. And they will also match your funds to support you in making improvements that they might suggest. So this program is prioritizing underserved and priority populations, and it's going through May 2023. So again, we'll send this in the follow-up for you to learn more about it or fill out an interest form, and they can contact you if you are eligible and interested. We also know a lot of people love toolkits and self-assessments that they can use on their own time and at their own pace. We love to point out Eco-Healthy Childcare's Environmental Health Best Practices Checklist. This is online and free in English and Spanish, and the website also includes a bunch of different helpful fact sheets. And so this is basically just a list of 30 things that you can incorporate immediately and think about in your space. So it's a really good baseline assessment and can give you some quick ideas for how to make your space healthier. We also have a practical guide for childcare in schools from CDPHE, and this is to help kind of distill all the guidance that's been updated so frequently around COVID-19 from the CDC. So we have a website where we keep track of that for you. You can find the most recent changes that have been made, and it's basically like bulleted lists for tips for how to make sure that your space is in compliance with the most recent guidance from CDC. Also, just want to quickly point out a couple other Colorado state programs we have for early childhood centers. The Child Care in Schools program is what establishes and enforces sanitary standards for childcare facilities, but their website is just a really easy to use, free, accessible resource with a bunch of fact sheets and informations on everything from lists of improved disinfectants for childcare centers, radon information, resources on how to get testing done at low cost to you for your space, poisonous plant guides, just a lot of different really interesting stuff. And we also have the Farm to Child program, which is focused really on local purchasing of fresh fruits and vegetables, gardening, and education. And the goal of this program is to help spaces incorporate healthy eating and growing of local foods into educational programs for kids. So if you're interested in having a Farm to Child program in your space, there are also grant opportunities to help you support creating that. And then lastly, I'll just point out these additional resources. In response to COVID-19, we've got a lot of inquiries about portable air cleaners for childcare spaces. So we created a fact sheet that can kind of tell you the do's and don'ts if you're interested in pursuing that route, and sort of what are the forms that have the best safety ratings and are approved and are most useful for your needs. Also love to point out EPA's Safer Choices website, which is basically a database full of any kind of cleaning supply you can imagine. It will tell you the safest options from the EPA's perspective. So ranging from like laundry supplies to other just general disinfectants. We also get a lot of questions about childhood lead exposure. So we have fact sheets available about lead exposure and also questionnaires that parents can take if they're interested about testing their child for lead. This is a good primer about whether or not that's necessary and kind of what they can expect. And then last but not least, there's a lot of attention paid to keeping the environment safe for the kids that are there, but we also want to make sure that everybody as an educator and anyone who works in these spaces, your health and safety is just as important. So our occupational health department has a lot of resources that are tailored to environmental to education settings, I should say. So we have things like crisis prevention for conflict management or other things that can happen in these spaces, guides for preventing your infection if you work in an early childhood center, and just a lot of other tips for keeping you injury-free and healthy in your job. So thanks so much for letting us talk about all these resources. This is our email here, but if you have any other questions, we can answer probably a few now. And again, we'll send out a master list of all these resources afterwards.
Not seeing any questions pop up yet. I just want to point out, a lot of these resources can be utilized in the Colorado Shines rating as well. Some of these self-assessments, putting out materials and resources for parents in programs. So we really appreciate the collaboration and the resources that you guys are providing. We do have one question here.
Yeah, I see about this new air quality and ventilation program. It is just starting, and right now only 50 programs can participate. So we know it's kind of limited at the moment. It is a pilot, so we're hoping to learn a lot from it and see where that goes in the future.
Awesome. Any other questions? Yes, Lisa.
Sorry, I'm always the one. There's this bill that's been trying to get through our legislative process regarding lead in water, and specifically targeting schools and childcare. And the most recent information that I read last night, I still am concerned about it and think that, is this the best way to use funds, and are there other things that we could be doing? So I don't know if that's impacted your particular work or not, but I'm throwing it out there.
Yeah, I appreciate that you raised it. For our state toxicologist who runs our office, it has been more involved in that. But I think you're absolutely right to point out the questions of what resources go where, and lead exposure can come from a lot of different sources. And so if you're just targeting water, you may be missing a lot from paint or other sources. So yeah, I'm not familiar with like the very specifics of this bill or where CDPHE and where that's going, but we're watching all of these legislative actions right now.
Thanks. Yeah, I mean, they're trying to revise it significantly, but I'm still concerned, and I have connections to my husband being a water expert, so it definitely is not feeling like the right action to take. So thank you.
All right. Well, thank you so much again. And we'll be sending out your presentation and all of these resources as well. All right. So next up, we have Kristen Lang and Larisha Longworth-Reed, and they're going to talk about PDG for us.
All right, good afternoon, everyone. I'm going to take just a second to put our presentation up here. Okay, so hello. I think I know most of you, but if not, my name is Kristen Lang. I'm the Program Access Manager for our Preschool Development Grant Unit. We have just a few quick updates. I'm going to go very quickly through mine, and then I do want to pass it over to my colleague Larisha with Butler to talk a little bit more about the triennial evaluation of early childhood councils, which, as you all know, is happening now. So this is starting with a quick reminder to please share the PDG Family Survey. This is a survey for families in Colorado with a child under the age of 6, and it's open until May 2nd, 2022. I know you've received a lot of communication around this, but just a push to continue to put it in your newsletters, share it with the families that you interact with. This survey is going to help us understand more about awareness and utilization of early childhood programs and services across the state, and needs and preferences specifically for early care and education programs and supports. And many of you will remember that it was a survey just like this that helped inform our needs assessment, which led to the strategic plan that the Preschool Development Grant has been implementing various aspects of for the last several years. And so it's just really critical. So we hope that you'll continue to share it. It is available in both English and Spanish, but we are hoping for more Spanish-speaking family responses. So if you work with organizations in your communities, specifically that work with Spanish-speaking families, that is an area where we haven't seen as much, as high of a response rate as we would like to see. And so the resources are all linked here, including an email message that you can just send out easily to any partner organizations you want to share this with. And I know Charlie's always good about sending the presentation after, so I will make sure I get these slides to him. They're all hyperlinked. I'll also try to put them in the chat, but I'm not good at doing that while I'm talking. So I'll try and remember to do that while Larisha is doing that. Lisa, I don't actually know, but Larisha might. So let me, and I can ping Lindsay too and see if she can give me a response on that, but good question. The other announcement I wanted to make very quickly was that we were able to recently select and begin cohort 3 of the Preschool Development Grant Inclusion and Universal Design Project. A huge thank you to our councils for helping to support promotion of this project in your communities and with the providers in your communities. We are working on developing a fact sheet about our third cohort and how it breaks down, but I wanted to share just some quick facts with you. So we selected 48 providers. Collectively, they serve 2,814 children. That's based on license capacity. So we all know that enrollment may look a little different, but they have capacity to serve over 2,800 children across the state. 31 of these providers are in urban settings and 17 in rural. This year, based on our preschool development grant evaluation from last year, which really called out that we weren't doing as well as we could to include some of our school district-based providers in a few of our activities, we were more intentional about that. And I will just admit that I've had a big learning and understanding over the last couple of years that while our school district-based providers often have more access to supportive resources than our community-based providers, particularly when we're considering our rural areas, that system of support may not always be very robust. And they also may be the only licensed provider in their community. And so when we thought about responding to this PDG evaluation finding, we thought we really wanted to be intentional about bringing in some of those rural school district-based providers to support their ability to offer inclusive and universally designed early childhood environments. So next week, the councils that have providers who are participating in this third cohort will see an email. So we'll let you know who those providers are. And just as a reminder, you can always find out who participated in the past. So our past cohort members on the Inclusion and Universal Design website, which I will put in the chat. So now I'm going to pass it over to Larisha, who I see is on the line, to talk about the triennial evaluation. Larisha, would you like me to stop sharing screen? Do you have slides, or are you just gonna?
That would be great. I have just a couple of slides to share with everyone. Good afternoon, everyone. Hope everyone is doing well this afternoon. I am just going to share a couple slides. So thank you for having me. I am an evaluator. In case you don't know me, let me introduce myself. For some of you, there's lots of people here today. So my name is Larisha Longworth-Reed, and I am an evaluator at the University of Denver with the Butler Institute for Families, and we are the lead evaluator on this year's ECC Triennial Evaluation. And our partner is EC Insights, and the evaluator there is Dr. Meg Franco. She's not joining me today, but I do just want to mention her in case you've gotten some emails or have heard from her. She is my partner on this project. Is everyone seeing my screen okay? Okay, great. So we are leading the ECC Triennial Evaluation, and I just wanted to use this couple minutes that I have to just remind everyone about the evaluation, what to expect, and kind of our timeline. So really quickly, the evaluation is intended to answer these 5 key questions, which are in statute. And so that's how we have designed the evaluation. So when you are going through the survey that many of you may have received, or you're going into listening sessions with Meg and her colleagues, this is our aim, is to ask you questions and to get information so that we can accurately answer these questions. while answering these questions, we know that there are limitations to just those questions that are in statute. And so we will be keeping an eye on the overall context for all of those questions and all of the work you're doing by attending to how it supports the early childhood framework, Colorado framework, and how councils are contributing to it through their specific innovations, their partnerships, any new services, and any initiatives during the pandemic that you may have implemented. In order to do this, we are collecting primary data from you, from providers in the community, and from providers in the community. The most important information on this slide is regarding the ECC survey. So that is the survey that was sent to councils. And the other piece here is the key informant listening sessions and focus groups, which you should have received a link to sign up for. I just want to remind everyone that for the ECC Council survey, those are individual links that went out. If for some reason you are like, what are you talking about? I didn't get that. I am going to, in just a moment, when I don't have so many things going on, drop my email in the chat for you. So please reach out to me and let me know if this is the first you're hearing of this and you didn't get a survey, because we want to make sure you got that survey. For all of those who have already completed it, thank you so much. And for those who haven't quite made time, we know it's very busy. We tried to keep this survey as short as possible. It is due May 9th, so please take a look. And if you have questions, reach out to me and let me know. And again, the last thing here is the key informant listening sessions and focus groups. So those are being conducted by Dr. Meg Franco and her colleagues. They sent out a sign-up link that came from ECLA, actually, to ask you to sign up yourself and any members of your council you'd like to participate. The deadline for that is tomorrow. I am going to reshare that link also in the chat so you have it. So if you can just, if you haven't already signed up, take a look and see if any spots work for you. If Meg and her team don't hear from everyone by the end of the week, they will just be reaching out next week to make sure that they get you scheduled. And finally, I wanted to just share an overview of the timeline. So this is what we're trying to accomplish in a very short time. We are currently at the end of April going into May, as you see here. And what we had on our schedule was to distribute a survey to ECC coordinators and to providers. We're a little delayed on providers. We're going to get that out 1st of May. And to do those key informant interviews, we're calling them listening sessions with council. So April and May, April's almost over, so May is very busy and we have a lot of information we're trying to collect. Once we get that information, we will be analyzing it and completing a report, which will be just delivered to the Office of Early Childhood on August 1st. Following that August 1st deadline, there'll be some approvals that need to take place at the Office of Early Childhood. And once everything is approved and that report is finalized, between October and the end of the year, we will be doing presentations about what the key findings were. And we'll also be creating infographics that are really easier to use than maybe a full-length report might be. So that's what you can expect from the evaluation. We've been planning since February. We've been working closely with ECLA and with the Data and Evaluation Subcommittee of ECLA to design the evaluation and get their feedback. And we're in the data collection phases, and then we will be moving into reporting and then presenting the data back to you in the fall. All right, and with that, I'm going to stop presenting so that I can take a look at the chat, because I think some things were popping up, and see if anyone has any additional questions. All right, I see that my email was shared. Thank you so much, Charles, for sharing my email there. And then I will also just quickly drop in the link to those signups for listening sessions and interviews that I had mentioned. So I want to make sure you have that, since Meg and her team are wanting to get those all scheduled for May, and there are some slots left for everyone. So there's that link that you can follow and get signed up. And again, if Meg and her team are missing any councils, they will reach out by phone next week to make sure you're all signed up. I would share, I can't really share a link to the survey, even though that's very important, because those links are individualized to you. Those links allow you to start the survey and come back to the survey as needed. And they also allow the survey to name your council individually, so it's personalized. But if you didn't get them, please email me. And I do know that a couple of councils have reached out about they've either accidentally clicked through to the end and hit submit before they were ready. They were just trying to get an idea of what the questions were. If that happens to you, don't hesitate to email. I can just reset that link quite easily and get you started again on there. Any questions or comments? I think we had, if we have, well, actually, Kristen, I kind of joined right in the middle of what you were talking about. So I'm not sure if you already discussed one of our questions around which provider group. We were, I think, going to get some more feedback on that from this group if we have time.
Oh, yeah. Charlie, how are we on schedule? We're okay, Karen? Okay. So we had the part of, as Larisha was explaining, part of the triennial evaluation includes a survey of providers regarding their interactions with early childhood councils. And so we have two options in terms of the list of providers that goes to. Option one would be any provider that is eligible to participate in QRAS. So not necessarily that they do have an MOU, for example, but that they are eligible to participate in QRAS. The second option would be a provider list that includes all of those providers plus summer camps and neighborhood youth organizations. And the question was, is the addition of the summer camp and neighborhood youth organization provider types appropriate for purposes of the Early Childhood Council triennial evaluation? Or is it the case that the most interaction councils have with providers is with those that are eligible for QRAS? And so we should limit it just to those and not include neighborhood youth organizations and summer camps. Of the feedback we've gotten thus far from the ECLA Data and Evaluation Subcommittee, it sounds like it's not necessarily going to garner very meaningful information back to include neighborhood youth organizations and summer camps, that the survey should be better targeted and focused on those providers that are eligible for QRAS. But if you think that that's really not true in your community, because in your community you work very closely with neighborhood youth organizations and summer camps, we just wanted the opportunity to hear sort of the counter argument, if one existed, to including them in that survey. And thank you, Karen. QRAS eligible meaning programs serving children 0 to 5. So if anybody feels really strongly about including neighborhood youth organizations or summer camps in that provider survey that's part of the Early Childhood Council triennial evaluation, please either reach out to Larisha. You can share your thoughts privately with her. You can put it in the chat. You can email me or Karen or Charlie or anybody who's of early childhood you feel comfortable sharing that with. But just want to give space to see if anybody did feel that way. And that's a good, so Karen, Jennifer put in the chat that they have a strong partnership with their after school organizations. Would that be part of the QRAS eligible provider list? It would not. So that would be one circumstance that might argue in favor of including some of the other provider types. Thank you, Jennifer, for sharing that. Oh, yeah, we can. Okay, so we could do the QRAS eligible 0 to 5 plus the school age, but still perhaps leave out neighborhood youth organizations and summer camps.
Yeah, the nice thing is we can filter the data by any of those identifiable categories. So if folks feel strongly about that, we can run the report with your 0 to 5 group plus your, licensed designated school. It's before and after school programs, basically, school age programs.
All right. Thank you so much, Kristen. We're gonna.
If that's not the consensus, let us know. Otherwise, we would proceed that way. Okay.
Thanks, everyone.
Thank you.
Thank you. Cool. And yeah, we'll be sharing out the presentation and the links that you shared as well. I'd like to welcome Lisa Castiglia, and she's going to talk a little bit about some finance stuff.
Hi, everyone. So for those of you who I haven't met before, I'm Lisa Castiglia, the CFO for the Office of Early Childhood. And what I wanted to talk today about was just invoicing for the indirect on the E&E grant payments now that we have, I think, gotten most, if not all, of the amendments processed to allow that. And one of the things that came up in our sort of figuring out how we getting things set up to allow this to happen is the federal requirement that, or the federal limitation on the amount of a contract or an award that you can earn indirect on. So for any provider, any ECC that uses the 10% de minimis rate as your indirect rate, that rate is 10% of what is called modified total direct cost, which excludes, which only includes the first $25,000 of any subcontract or grant or award. And so what that means is that we will only be able to count the first $25,000 of any grant that you have given out in the calculation of indirect. So this is going to be maybe a little bit more complicated. I think Karen, you can sort of jump in here. It sounds like what that means is we're not going to be able to do the calculation of indirect through sugar. We will likely need to create a separate, well, I'll let Lisa, you jump in with your question before I sort of talk about potential options.
I just want to make sure I understood. Is it the first $25,000 total or $25,000 per provider that we're supporting?
$25,000 of each award.
Okay.
So yeah. So what we'll need to do is find a way to sort of like, I'm thinking we're still putting together what this might look like. So I'm sort of talking through options, but I'm thinking that like invoicing would have, you know, the amounts for awards that are less than $25,000 and then an indirect calculation or an amount billed for awards that are more than $25,000, which might need to have a separate sheet that lists them all out so that we can calculate up to that $25,000. I'm working on the formulas for that, that would sort of just allow you, that we could populate with the data that comes out of the system. And then you just have to enter how much you were billing on those so that we could calculate up to that $25,000 to make sure that you can earn it. Yes, so you sent me a copy of that, Karen, by ECC. So my intent was to take that list of grant awards that exceed $25,000 and sort of list those out on a billing template for each ECC, and then and then we'd have to like kind of figure out payments against that and where we could earn indirect. And Lisa, if you can, like I know we've done this before, maybe not on such a large scale, but yes, maybe I can send a, sorry, my dog is going crazy. Hang on one second.
Yeah.
Yeah, I think one of the things we might want to think through is the sugar side of this, since you guys reconcile those in sugar, but the indirect would just be added on. And I guess where I get a little confused really is when you're billing us incrementally, right? So at what point do we add the indirect on, and then how do we, you know, make sure it doesn't go over that threshold? So
Yeah.
yeah, so trying to figure that part out.
That's the part that's challenging, but I know we've done it through billing templates before. So I think we'll, I just have to play around with the formulas a little bit to try to make it sort of as user friendly as possible. But so you would earn indirect on the first, basically it's on the first $25,000 of each award. Now, I know that you have reimbursed some awards before we've earned indirect, and that's like, I'm saying the first $25,000 from the time we start reimbursing the indirect. So if you've already paid someone, you know, $40,000 and there's $20,000 remaining, then you earn indirect on all of that. It's just, Lisa? Oh, you're on mute still.
Yep, that was kind of that complicating factor. I was looking at that this morning, and yeah, I do wonder if it's a matter of sort of looking at where programs were at in terms of their balances at that point in time, and then calculating the max percent that we can collect an indirect there, and then deducting amounts as we are billing those requisitions, because they are piecemealed. So you determine what your max is for each one, and then you're tracking that spend down.
Yeah, so I think it could go either way, either determining that and tracking spend down, or like tracking each billing against like the cumulative amount up to a $25,000 limit. So I think like it can go either way. It probably depends on which calculation is easier. So maybe it makes sense for me to sort of put forward an example of something I think that we could use and send that to, I can send it to everybody. I can send it to maybe a couple people. I'm thinking maybe Lisa and Lisa. We can have like the trifecta of Lisas, try to figure out how to get this done. But maybe I can send you something, you can play with it, see how it works before we push it out to everybody. Knowing that I want to get it done quickly so that we can start giving you indirect on these reimbursements.
Yeah. So Lisa, real quick, like if somebody's billing us today, should they just, in order for cash flow issues, because we had a little bit of that, go ahead and send those invoices through without the indirect so we can get that part of it paid out, and then come back and reconcile it if their amendments are already completed?
I think we could do it that way, or I guess my question would be, if you're invoicing today and you have indirect costs, like if you're paying more than $25,000 to one provider, if you're not paying more than $25,000 to one provider, then go ahead and bill your indirect as it is, and we'll figure out how to reconcile. Flag it for me if you are, and we'll figure out how to, or maybe only, I don't know how many, trying to figure out the best way to do this.
I do want to, while you're thinking about that, I do want to mention to everybody on the phone, this is only about the GAE. So your base funds that you're billing to us, you can put your indirect on.
Yeah. And I want the indirect to be part of the GAE billing if you're like now too.
Right.
So I would, so I would say, I don't know, what do you think is best? Would you prefer to like only enter the indirect on things that are not exceeding $25,000 right now? Should we, do you want to flag it if you have reimbursements that are over $25,000 so I can figure out something really quickly to make sure we can include it? I don't know, like, I don't know how big the problem it will be with the invoices that are ready to go right now. It looks like Lisa had her hand up and then Mandy.
Sure. No.
Oh, you didn't? Okay, then Mandy.
Okay, so I've got several to send in. And my thinking is it would be easiest to just put them in a spreadsheet and send it individually with you or with the invoice to show you which is which.
Yes, and then we can.
I can make it really, really clear.
Right.
And Mandy, I don't know that I fully answered your question after I reread it, but yeah, it's per. So if an awardee got both capital and materials and maybe PD or something, it would be that whole bucket of allocated amount.
That is my question. So really, they're capped at $2,500 per provider.
Yes, the maximum amount of indirect that you would be able to collect on each awardee is $25,000.
Gotcha. Okay.
Yeah.
So Lisa, one more clarifying question. There's a handful of ECCs that have an approved federal rate that's not the 10% de minimis.
Yeah.
How does that work for that group?
So that's going to depend on what the base is for that indirect rate. So if, like, a lot of times, those rates are negotiated based on, you know, yeah.
Should we only have a couple. I know Pueblo, Red Rocks, there might be one or two more. Maybe we could, you know, get a call with that group or something. I don't know.
Yeah, I mean, because honestly, there wouldn't be indirect earned on that. Well, yeah, I need to think through that. I'm thinking that we are going to have some situations for indirect where we're probably going to have some workarounds in looking at how we are able to like budget and support some ECCs that can't earn indirect to support this work. That there are, you know, if your indirect is based on salary and benefits, then very likely you're not going to earn indirect on the payments that you, the grant payments that you move through, which is problematic, right? So figuring out if there's a way to, you know, build in a direct charge for that work. I think we're going to have to work through those situations individually, and figure out where those hardships are and figure out how we can make it work. Okay.
Okay, so where there are exceptions, let's, if we could, if you could reach out to your coordinator, we can identify, well, each of you who have questions on this, then we can loop around Lisa and Laura and figure out what we need to do.
Yeah.
Awesome. Thank you so much, Lisa, for coming on to share this information. And yeah, we'll stay in touch about this. And it sounds like everyone is kind of working on their solution. And yeah, hopefully we can just kind of move forward with this.
Yeah, and I know, guys, our team's going to have questions as well. So feel free to bring them forward to your coordinator, to me, but know that we're going to have to take these back to our team because we don't have the expertise necessarily to answer these questions, but we'll work with Lisa's team as fast as we can.
Yes.
Cool. Thank you. I just wanted to share real quick a couple other reminders from our team. All right, so just a couple reminders here. We have our merit awards. If anybody is receiving a merit award between the end of April and the beginning of July, that amount is going to hold over. Just make sure that you have the program who earned it sign an MOU coming up for next fiscal year. Just a reminder to get June invoices, accrual amounts, everything like that. We need everything in by.
So
yeah.
So on that one, on June invoices, we're working off of that first. We don't have the exact date, but we're working off of the July, first week of July date. So as soon as possible, if you could get June invoices in that first week of July. But if you cannot, then we will need your accrual amounts. So anything you need to bill us for that you don't have all pulled together, we need those amounts by June 30th, or that first week of July as well. So if you can't get the invoice in, get us the dollar amounts. And then we will definitely need invoices no later than September 15th. So this is in particular to your E&Es who are doing their final, push to the end, and they're not going to get receipts to you until, the very last minute. You can keep track of those dollar amounts. Let us know what those are so that we can accrue for those at the end of the fiscal year. And then all final invoices for this fiscal year have to be in by September 15th. So if you have questions about that, definitely reach out to us and we can talk through that a little bit more. I don't know, Lisa, if you've got a deadline on the July. I don't think we do yet, but usually it's around the 5th of the month.
Yeah, it's usually we usually have to get everything up to accounting to be paid that first business day after, it's right after the 4th of July. So we typically need you to get things submitted by right after the first business day after the 5th, and then we usually, or the first business day after the 4th of July. And then we typically have 2 days after that in order to get them upstairs to accounting for processing. So it's a pretty quick turnaround for everybody. I will say that the accrual deadline is usually 1 week later. So you have a little bit more time to get that. So if, and actually I can look at the calendar really quick.
While she's doing that, I do want to remind everybody, we need to see a reconciliation out of sugar on a monthly basis. Even if it's 0, send it in. But we do have lots of ECCs still that aren't billing us monthly, and that is part of your contracts. We definitely need to get everybody doing that. A lot of it is just because we've gone through a recent audit, which I'll get to share information with you guys on that probably next month. But that is one of the things that we have to commit to, is getting monthly invoices from every ECC. So we'll talk about that a little bit more, but Lisa, go ahead.
Yeah, I was going to say, I would expect the deadline for invoices for you to submit to be like July 6th, which is that Wednesday of the week of 4th of July. And then we will likely have to get them processed and upstairs by the 8th. I would then expect the deadline for accounts payable accrual information to be that following week, so the 13th of July, in order for us to get it again processed and upstairs by the 15th. So
that's super helpful. We'll put that in our notes, Lisa, and get that out to everybody.
all right.
Cool.
Thanks, everyone.
Thanks, Lisa.
Bye.
And just one more quick reminder here. So quality improvement applications are going to be opening July 1st this year. I think last year it was June 1st. So it is delayed here just so we can close out everything and make sure that we're ready to go on July 1st.
And get those. And then once these open up July 1st and everybody starts applying, that's when we can get the merit awards that were earned between that April and July 1 time period, then allocated to those new applications.
And Lisa has a question.
Yeah, so this is really challenging because we pay coaches based on coaching hours. And last year there was a huge glitch with the applications, which meant that we had 6 weeks worth of no funding to pay our coaches for the most part. So I just, this is really challenging when.
Yeah, Lisa, you know what, let me take this back and let's see what, if there's something else that we can figure out on this. I'm more than happy to try to figure it out. I know that's why we probably opened up applications a little bit sooner last year, but this year we've got that darn merit. In hindsight, I would have done this totally different, but merit award issue. So we'll go back and chat with the EC Connect team and see if there's any other options for this and get back to you guys on it. Because I was reading through this yesterday and I was feeling a little nervous about it, to be honest. So let's see what we can do, and we'll re-communicate this out if we can open that up sooner.
Well, even if we can open it up for sites that aren't eligible for a merit award, I mean, is that the issue?
I think it's that more of the ECCs were saying that they needed to close out their books, so that they did so that the merit awards couldn't be, like, the merit awards were earned, but they couldn't pay them the checks fast enough, and then they would go away as of June 30th. I think that's what I was recalling from a last conversation.
Then Karen, do you want to speak on the E&E new funding down there at the bottom real quick?
So anyway, we'll revisit this, you guys. I'll get together Lilith Snow on our team. She's got some good, insight into this. We'll get Bill on the phone from the EC Connect team, and we can talk through this, and I'll revisit this with you guys. So yeah, on the E&E, the new, as you guys know, you've been following the legislative process, and we have some additional funding coming in, and I know it's good news and bad news. And so we would really like to have a couple of volunteers. If you want to reach out to my email and just let me know if you want to be participating, but I'd like to have a couple of ECCs along with some licensing specialists and our E&E team to kind of come together and talk through, what we might want to change with guidance, what we might want to change with communication, what worked well in the system, what didn't work well, so that we can prime ourselves for this next round of funding that's going to be available in July, and be collaborating on how best to tackle this next set with a lot of lessons learned in the interim. So if you're interested in helping out with that, shoot me an email, and then we'll get some times on the calendar between mid-May and June to get ourselves set up for success on this next round.
Awesome. All right, we do have to move along. So if you have any questions on any of this, reach out to Michelle, Lilith, or I, as always. Let's see, I think we have Angela up next.
Good afternoon, everybody. Thanks so much for having me today. Given that we don't have a ton of time left on the agenda, I'm just going to share a deck that I shared this last month, so it's not anything new other than a few updated components to where we're at with implementation. So I'm not actually going to show this on the deck or on the screen right now, but I feel like I could just share that for folks to go through on their own time. It's those same kind of continuum visuals that we shared last time on, how we're supporting new, existing, and other professionals who are interested in work-based learning opportunities, where we're involved with higher education support, where we're involved with professional development support, where we're strengthening our PDIS work with the help desk and more course offerings and things of that nature. And then everyone is aware that we're having a lot of compensation conversations alongside this with both stimulus funding and through our new department planning. So again, no major updates to strategies other than the fact that we currently have a solicitation open for the apprenticeship model. So if there are any other partners who are interested in developing an apprenticeship model, that will be available through May 6th through our state website, and the links are in that deck. I was hoping today to have an update for all of you on implementation of this higher education scholarships, but it looks like we're a little delayed still on that. So I'm going to work with CDHE to schedule some time with you all, either on the Hot Topics call or maybe the next state TA day, see if we can grab a little bit more time to talk about how we can make sure that new students who are interested in pursuing higher education degrees and certificates can access some of that scholarship funding. So the current allocation for spring 2022 is obviously will be going into effect long into the semester. In fact, probably close to when the semester will be ending. So that's only really available to current students. So moving forward, we want to make sure that we have a plan on how new students can get access to some of that funding, or what to expect from the higher education institution that they may be attending. And the intention is to have all community college system campuses, all public four-year universities, as well as a couple that don't fit into those categories. So we can bring that list and all of that information to a future, like I said, it's either a state TA day or a Hot Topics call. So I'll make sure that you all are aware of when we're going to have that conversation, as I'm sure it will be really useful for you to do some outreach in your communities, especially in programs that maybe are having trouble staffing at this point. And we're also looking into some other opportunities for possible waiver options through some of these scholarships. So just know that the CDA model is a wonderful model to use for those high quality programs across the state that has someone in CDA training, and they can act as a provisional early childhood teacher. So I'm hopeful that we can mimic that model in some of our other scholarship areas. So more to come on a lot of these opportunities, and all of the links that you'll need are available in this deck. And you're always welcome to reach out to me individually if you have questions. So Charlie, I know I wanted to help make up some time for you all on the agenda, as I wasn't sure if there was someone after me still.
Thank you, Angela. We appreciate that. And you all know to reach out to Angela and she'll get back to you right away. She's great at that. Cool. Yeah, we have one more quick presentation. So Robin's here to talk about Pyramid Colorado certification.
Oh, thanks, Charlie. I'm going to pull up my slide deck here. Okay. I think you can all see. Are you good? Thank you so much for having me. My name is Robin Levy, and I am the Pyramid Coordinator for Healthy Childcare Colorado. And we wanted to take just a few minutes to tell you a little bit about the Pyramid Network Hub and updates on facilitator certification. First of all, we do have 3 hubs: the Child Care Health Consultant Hub, the Early Childhood Mental Health Consultant Hub, and the Pyramid Hub. And you can take a look at more of these slides, but I want to kind of get to the details that I think you're going to be most interested in. So first of all, when we talk about our Pyramid Coordinator certification, or excuse me, our Pyramid Facilitator certification, we want you to know that it really is an intentional professional development pathway. And our goal here is really to support growing Pyramid in our communities. The certification program is a 10-month program that we plan to have annually, running from September through June. And it includes opportunities for strategies related to facilitating Pyramid training, the 45-hour training in the state, as well as providing Pyramid coaching using the observation tools, which are the TPOT and the Tippy Toes for infants and toddlers, as well as preschool, and also to participate in program-wide leadership team planning. So our certification process will give facilitators, as they come out, the opportunity to do Pyramid work in a variety of different avenues. Eligibility for becoming a candidate in certification is very much so that you have to have completed either both the CEFL infant toddler modules 1 through 3 and the preschool modules 1 through 3B, which again equates to approximately 45 hours, or the full Pyramid Plus approach training, the 18 sessions. We're also asking for trainer credentials within the past 5 years, or at least the adult learning parts of it, and giving us information on that. Applicants at this point in time need to live and or work in our state, and they have to be available for a variety of key dates that we share with them beforehand in our documentation. The certification content and what they get in those 10 months is more than 50 hours of Pyramid-related training, included training on the top of the pyramid, the PTRYC. We're talking about Rosemary Allen's training on bias that she did for NCPMI, achieving observation tool reliability. So a lot of additional training, especially in that first part. But in addition to that, certification members in the cohort will also receive and facilitate both of those things, group coaching. They'll receive it in small groups from a support advisor, and they'll facilitate it with their own coachee. They will also receive individual coaching as well as facilitate individual coaching. In addition to that, they are going to be doing a lot of practice training with each other on the content and receiving feedback. And then certainly we're going to be using a lot of meetings and huddles to make sure that groups are really grounded in their work. The timeline for how these 10 months lays out generally in this manner. For August, it's going to be starting out with orientation once somebody's been accepted into the cohort, and meeting the support advisor and the rest of their small group. So the cohort is going to be broken into small groups of 6 or 7 people, and each small group has a support advisor to really sort of facilitate their group work together. September through November is receiving a significant amount of training, additional to that prerequisite 45 hours of training. In addition to that, there is again the observation tool reliability, bias training from Pyramid Model Consortium, reviewing a coaching agreement and a coaching pack, and the PTRYC training. As we move to the next year, regardless of what the year is, we're going to get more into sort of the coaching aspects, and we're going to be doing the individual coaching and the group coaching. We're going to actually get our coachees. Each candidate will connect with a coachee that they get to practice with and do a tippy toes or a teapot in there. We have a tool called the 9 Essential Skills, which really helps us provide feedback on their training practice and doing a lot of work in those small groups. And then finally, in June, we will make sure that all folders and files are complete, and we will celebrate because it's a lot of work that certification candidates are doing in this 10-month period. Moving on, we wanted to give you a little bit of information about the fee structure for becoming a pyramid facilitator. The cost is $2,000 per participant, and it includes a significant amount of stuff as well as time and attention from support advisors and myself. And those are listed here. The first one is this unpacking book, which is really the first book that was written from the perspective of teachers from the pyramid model people, and they can't keep it in print. It's so popular. And some of these other things that you have seen, I've already mentioned. I do want to pull your eye down here to kind of third from the bottom, a pyramid teaching materials kit. We have a couple of places that are doing these pyramid model kits, sort of launch kits. Now that you've been through training, instead of pausing to make stuff, how do you really jump in and start implementing immediately? And these kits are going to be provided so that they can be either gifts to coachees, candidates can use them as they practice training a variety of different ways. Certainly the Certification Institute, which is our launching of the cohort in the beginning, and then lots and lots of time with your individual support advisor, as well as working in tandem with the rest of the members of your small group. For the application process for pyramid facilitators, we're asking for a letter of interest and a resume that gives a little bit of information specifically regarding pyramid experience. We also are asking for a letter of support from a supervisor if you're working at an initiative or for an organization. We know that certification takes a significant amount of time, and we want to make sure that whoever is applying has that support from their supervisor. If somebody is self-employed, they can write their own letter of support. Again, for the application process, we need to see that the person applying has completed that full 45 hours of the pyramid content before coming to certification, as well as the trainer credential or some other documentation of formal adult learning and facilitation experience. We really hit the ground running in the group work that we do related to facilitating the content. So we need folks coming in with those skills. And then certainly they need to complete the online application that includes a variety of narrative questions. The application and selection timeline is listed on this slide. We're going to launch the application on May 2nd, and it will be open for the whole month of May, not closing until close of business on Friday the 31st. Additionally, there's going to be an information session for anybody interested in becoming a certification candidate on May 5th, and we'll record that and post that on our website so that folks who might not be able to make it can see it. We'll make sure that we notify everybody about their application status by June 10th, and we ask for a completed letter of agreement and payment on or before July 22nd. We were really purposeful in making this deadline for payment in a manner that entities could play across one or the next fiscal year, or even both, depending upon the needs of the entity supporting a candidate. And I think that covers most of our stuff. So thank you, Charlie, for your 10 minutes. I think I took every single one of them.
Thank you. And we apologize for having to rush through that a little bit, but folks know who to reach out to if they have questions. And we're really excited that you guys have created this for the community. This is going to be super cool to see play out. So I know that's our time today. It's 2:31. So thanks for hanging on an extra couple of minutes. And we had some things pop up last minute this month that we really wanted to address and get a conversation going about. So if you have any lingering questions, concerns, anything like that, please reach out to your QRIS coordinator, and we're more than happy to work those out. Thank you all. It has been a crazy few months. It seems like dust is settling a little bit until the next one. Of course, don't count on that. But we appreciate you all so much, and thank you for your collaboration, and thanks for a great Stay TA Day. We appreciate you.